Julia, one of the things when we talk about safety, which I have a number of things to ask you about, if we start from an overview level, when it comes to thinking of something, many people have a question of, oh, is this safe or could this be problematic and so on. But of course, that question of is something safe depends on many things. It's very context dependent. From an overview level, could you maybe talk a bit to this about how different aspects or the different contexts that we place that question in will determine whether something can be deemed safe or not in those specific situations?
Yeah, absolutely. I think context, especially when we talk about supplement, plays a crucial role. And it's, of course, is important to know, if I'm taking a specific supplement, if I have any specific condition, medical condition, or if I take medications, that is, super important to keep into account. But also factors like when I take the supplement, or, how is the supplement formulated, or how am I taking it in the sense of, am I taking it orally? Am I injecting it? Am I applying it on the skin, inhaling it? Because in the different contexts can really change whether a supplement is safe or unsafe for you. So if you agree, I can kind of discuss a bit each of these points individually because I think they deserve a bit of time.
Fantastic. That'd be excellent. So there's a number of those different contexts that you mentioned. So maybe let's work through those and feel free to start with the one that you think maybe is a good jumping off point for us.
Sure. I think, timing. So when should you take a supplement definitely matters. And I can think of timing in two different ways. So timing during the day, I'm going to use a very basic example here, but melatonin. Melatonin is a supplement that you normally take to normalize sleep patterns, and you take it before bed, usually. If I take my melatonin supplement at 8 in the morning with my breakfast, I might start getting symptoms of drowsiness, dizziness. So something that was a wanted effect suddenly becomes a side effect because I'm taking it at the wrong time. And also I can think of timing relative to other supplements and also to other medications that I'm taking. And I think iron is a good fit here because iron interacts with so many medications, supplements, and also food, like, just to give you a few examples, like grains, seeds, calcium, non-fermented vegetable proteins, polyphenols. So usually we, as in healthcare professional, suggest to take iron supplements either on an empty stomach or 2 hours before, 3 hours after, to avoid any, interaction, to avoid impacting the absorption of iron. And now moving on to formulation, I would like to start saying that not every version of the same supplement is the same. So when you go to a health food store or you go to a pharmacy, most likely you're going to find so many different versions of the same supplement, but most likely they're not going to be formulated the same. So we do need to look into that. And there are a few aspects that I think should be highlighted. So firstly, the form of the active ingredient. Now, I'm going to be boring and use iron again as an example, but iron you can buy, in tablets, capsules, liquids, whatsoever. But when you buy an iron supplement, you're most likely not going to buy elemental iron. You buy an iron salt. And different iron salt provide different amount of elemental iron once they are metabolized. So to give you an example, 300 milligrams of ferrous sulfate roughly provides 60 milligrams of elemental iron, whereas 300 milligrams of ferrous gluconate roughly provide half of that amount, 35 milligrams roughly of elemental iron. So why does this matter in terms of safety? It matters because if I'm trying to correct an iron deficiency anemia, and usually ferrous sulfate is what they use as a first-line treatment, I noticed a lot in practice when I was working in pharmacy that people struggle to stick to this therapy because ferrous sulfate can cause stomach upset, stomach cramps, constipation, a series of side effects. And someone might think, oh, let me just switch to ferrous gluconate. I've heard it's a bit more gentle on the stomach, without realizing that actually you're not getting the same amount of iron. So if you're trying to correct a deficiency that is really important, obviously. If you take iron as a supporting supplement, that might not make a huge difference, but it can be pretty severe if you are severely deficient. And also, I think another aspect that is worth highlighting is the technology used to make the supplement and the processes that are used. So, as you know, you can find supplements in so many different forms now, like tablets and liquids and capsules, aerosols, creams. But you can also have supplement formulated with specific technologies that increase the bioavailability of an ingredient. And examples include liposomes, like microspheres, micelles. And by increasing the bioavailability, which is the ability of absorbing the active ingredient, you increase the efficacy of a supplement, but you also increase the likelihood of side effects and interactions. So one example is curcumin. Like if you buy curcumin powder from the grocery store, you're probably, not going to be able to absorb much from it. But curcumin supplements are often formulated using these enhancing technologies. They're often formulated using these enhancing technologies. And by increasing the efficacy and bioavailability of curcumin, again, you can increase the likelihood of it interacting with medications you're taking or, causing more side effects.